Tell us about the experiences you were having that led you to look for a solution.
Certainly. So looking for a solution, really what drove that was kind of a heightened physiological and stressed state. PTS and the normal pattern in combat has you hyper aroused and ready to go. That doesn't really need to be, around the kitchen table, and it's difficult to switch that off. For some people, it's almost impossible. So dealing with that state of being tense and under stress is it's extra difficult for no reason.
Describe the experience of getting the procedure that helped.
Right. So I went to Google looking for who could do a stellate ganglion block and came across Associated Physicians Group. I was surprised because I was already being seen for them for some joint pain and some lower back pain. Really, the procedure was very simple. It was a small pinch with a needle, a little bit of a sensation, and then the injection went in. And from there, it was almost an immediate arrival of that time for stimulus and response to kind of think about how we want to react. It's great.
Now let's talk about the exciting part. What has life been like since getting the procedure?
Life's been a lot better. I would describe this as putting the space between stimulus and response back where it needs to be, instead of an immediate reaction to a stimulus in the environment. So it really gives you that normal reactive kind of thought process back in versus the physiological, amped up, ready to go kind of reaction.
Give us an example of an experience you had before the procedure and how you've noticed your response changing since the procedure.
Sure. Yeah. Something I find important is to analyze and think about the feeling that you have in your body, just kind of as an overall theme. You can tell when you're hyper aroused. You can tell when you're stressed and tense. A good analogy is, the cup of milk goes over at the dinner table, and you're instantly, let's clean it up. Hurry up! Grab something to clean it up with, and that reaction is not really necessary. This injection kind of gives you that space back between reacting like that. And it's not so much an emotional reaction, it's a physiological response to what's happening around you, is to try and hurry up and get control of the situation and get things back in order, which in combat is very important, but around the kitchen table is not quite as important. So, if I had to say anything to someone who thought that they were struggling with PTS, I would say self-identify and tell yourself it's okay to ask for help. The stellate ganglion block is a simple procedure with almost no side effects at all. For me, it drastically increased my quality of life. It gave me that quality of life back because I had that physiological disconnect from being hyper aroused all the time in a state that combat puts you into. So I would say to you, there's nothing wrong with you. You're reacting as a human being reacts to this type of thing, and ask for help. Get help. You can get help at Associated Physicians Group. You can try a stellate ganglion block, and you can seek assistance elsewhere, but don't keep it all inside. You don't have to carry the burden all on your own.